Hello, this video will present the diagnosis and treatment of migraine headaches. This video is in conjunction with what we are studying in week 5 for NU 621 Advanced Pathophysiology. These are the references that were used to put together the video. Again, all of this information is public domain, and you can download whatever you need to. The International Headache Society is a great website. They have many different things, articles and guidelines related to headaches of all types. The document there for migraine headaches is quite extensive, and we'll talk a little bit about that in the video. Question number 1. Which of the following types of migraine is most common? 1. Chronic migraine. 2. Migraine with aura. 3. Migraine without aura. Or 4. Migraine associated with analgesic overuse. Let's take a couple of seconds more. Alright, the answer is migraine without aura as the most common migraine that there is. This was previously classified as common migraine and accounts for 80% of all migraines that are reported. The International Headache Society updated their classification of headaches in July of 2013. When you look at that document, there are literally hundreds of classifications for headaches, and for migraine, each of the major categories has multiple subcategories. They're used for specific billing purposes in your clinical practice. So you don't need to memorize them all, just know where to look for them so that you can diagnose correctly and treat correctly. But the migraine classifications are migraine with aura, migraine without aura, complications of migraine, probable migraine, and episodic syndromes that may be associated with migraine. It can give you a headache. There's so much distinction. Next question. Which of the following groups has the highest incidence of migraines without aura? Again, migraines without aura is the most common migraine. So which of the following groups has the highest incidence of this? Number 1, boys aged 7 to 9 years, girls aged 7 to 9 years, boys aged 14 to 17, or girls aged 14 to 17. The answer is girls aged 14 to 17. Statistics based on epidemiologic and demographic data show that 75% of the people who have migraines are women. Migraine with aura affects both boys and girls, and in boys it peaks at the age of 5, and in girls it peaks at the age of 12 to 13. Migraine without aura, the most common migraine headache, also affects boys and girls. In boys it peaks at ages 10 to 11, and in girls it's later at 14 to 17 years of age. Next question. Which of the following is the most common visual aura? Number 1, micropsia, or objects appear larger than they are. Number 2, scintillating scotoma, which is an arc or band of absent vision with a shimmering or glittering zigzag border. Number 3, micropsia, objects appear smaller than they are, kind of like in rearview mirrors in cars. And 4, achromatopsia, low visual acuity, color blindness of varying degrees and types, day blindness, and nystagmus. The correct answer is number 2, scintillating scotoma. The article that is referenced at the beginning of this presentation has a really beautiful picture of what an aura might look like. But it's not beautiful if you have it associated with a migraine. But there are uniform flashes of light. Sometimes there are visual hallucinations accompanying the migraine. Next question. Which of the following is recommended in patients with migraines by the American Headache Society? 1. Neuroimaging studies in patients with stable headaches that meet criteria for migraine. Number 2, CT in non-emergency settings. Number 3, long-term use of over-the-counter medications for pain control. Number 4, neuroimaging in patients with new onset migraine after the age of 50 years of age. The correct answer is 4, neuroimaging in patients with new onset migraine after the age of 50. The guidelines denote the following as recommendations for when neuroimaging is appropriate. First or worst severe headache, to rule out other pathology. A change in the pattern of a previous migraine. Abnormal neurologic examination. Onset of migraine after the age of 50. New onset of a headache in an immunocompromised patient, such as someone with cancer or HIV. If there is a fever accompanying the headache, migraine and epilepsy, or there is a new daily persistent headache, or there's an escalation of headache frequency and intensity in the absence of medication overuse, or the headache is posteriorly located, especially in children. The treatment falls into two categories: preventive and acute. Preventive is prophylactic, actually trying to prevent the migraine from occurring. But they also classify preventive as reducing the frequency and severity of a headache that does occur. The first-line preventive drugs are listed here: anti-epileptics, beta blockers, which has been a staple for quite some time, tricyclic antidepressants. You'll see Celexa is a very popular drug for treating migraines. Calcium channel blockers, SSRIs, NSAIDs, and this can be in the dose up to 3,200 milligrams per day of ibuprofen. Serotonin antagonists, there's research that shows that botulinum toxin injected into the face helps with the severity of migraines. Abortive drugs, these are used once the headache has occurred, includes the SSRIs, the 5-HT1 types, the ergot alkaloids. Remember, ergot helps constrict blood vessels. It's a potent vasoconstrictor, so that then reduces the throbbing and the pain of the migraine. Again, not NSAIDs, and again, many times it's given when the headache first starts. The recommendation is to take 1,600 milligrams of ibuprofen, and if in 3 hours it hasn't gone or is not reduced, then you can take another 1,600 milligrams. There are combination products and antiemetics. Any questions? Please find a source that you like, find the national guidelines, and of course you may always call me on my cell phone and we can discuss this. Thanks again for your time.